Welcome to the IFRS Health Education videos. Today we are going to talk about gasless appendicectomies. Appendicectomies is a very old operation. In fact, the first one was carried out more than 300 years ago. And for more than 200 years, the open surgery which are carried out for appendicectomies has been the gold standard, and not much has changed. How did this happen? Because the lifetime risk of having appendicitis is almost 8%. In other words, it's a very common problem. And surgical treatment was decided as the best treatment more than 200 years ago. In fact, a Russian surgeon who was working in Antarctica did the appendicectomy on himself to save his life. And one thing you need to remember is that it is a clinical diagnosis. Although people might insist on having a CT scan or ultrasound examination for diagnosing it, they are not necessary. 100% of the time, it is the clinical findings with maybe a little bit of minor lab test would be able to diagnose the condition. It presents with severe abdominal pain in the right lower side of the abdomen, nausea, vomiting, and so on. But any doctor should be able to clinically diagnose it comfortably. Although the open surgery was the standard treatment for more than 200 years, the laparoscopy surgery started in the early 80s. And by the year 2000, almost half the appendicectomies in the West were done by laparoscopy surgery. This is because the less wound infection, the short hospital stay, and the possibility of making the right diagnosis through an incision in the umbilicus first. Later on, people wanted to do single incision laparoscopic surgeries. In other words, they wanted to do the entire surgery through opening in the umbilicus. This started in the 90s. But unfortunately, it is much more expensive, very difficult, and did not have any advantages because it made the simple task very difficult. And operating was difficult because you need to pass many instruments through a small incision. And you can't have a very clear look also. Hence, this was decided that's not worth the effort. And even in rural areas, people wanted to start doing a single incision surgery. So they made what is called the Cloudport. It's a simpler or less expensive version of the more expensive single incision surgeries, which is carried out. But what really benefits the rural areas is what we call the gasless appendicectomy. Here, instead of the gas which is used, which necessitates the use of general anesthesia and is much more expensive, and all the expensive instruments are necessary for surgery. Instead of that, it's a simple device which raises the abdominal wall, and it's possible to do the appendicectomies through a single small incision in the appendix. And this is much easier with the gasless surgery compared to even the standard laparoscopic surgeries. These are available in many of the rural hospitals and at a much lower cost, and is probably the best possible treatment option which is available for appendicitis now. Thank you.